Great, thank you very much, Kathy. Thank you for inviting me to speak today. As Kathy said at the start, I'm going to be talking a little bit about NICE's work within data analytics area, focusing specifically on a new program, the Methods and Standards program. And by way of introduction to this program, I'm going to very briefly describe how we in NICE currently use sort of real-world data in our guidance development and how we might want to use it in the future, and think about some of the barriers to that. And then I'm going to try and touch a bit throughout the presentation and at the end on how the work that this consortium is doing and also HDR UK slightly more generally are very relevant and hopefully informative to this work. So for those of you who are slightly less familiar with what NICE does, we essentially have two types of guidance program. We have our health technology assessments, where companies who have developed a new, say, medicine or device will present evidence to NICE, which we evaluate through our committees. And then we have guidelines, most historically clinical guidelines, but more recently also public health and social care guidelines. And these cover, wider range of questions from identification through to the management and treatment of different conditions. And we develop these in-house. So while they're quite different in terms of the processes and the scope, they do share a common methodological basis. And we are interested in comparative effectiveness and comparative cost effectiveness against standard of care rather than placebo. And we're also interested in cost effectiveness over patients' lifetime. And this, because trials are relatively short in duration, requires mathematical or economic modeling. So the reason I mention that really is because in terms of how we might use data such as that from this consortia in our work, one of the key uses would be in populating our economic models. And this is actually already a very common use case and widely accepted by our committees. So we often use it to model baseline event rates of different conditions, looking at resource use, extrapolation to longer term outcomes, and so on. And we also use it to provide contextual information about disease burden, unmet need, treatment patterns, and also patient experiences of diseases and treatments. And then finally, the area which is slightly more controversial and slightly more interesting, perhaps, is about its use for comparative effectiveness. And it's probably important to note that in some senses, NICE is required to think a lot more about real-world data and comparative effectiveness, because new drugs are increasingly based on single-arm trials without randomization. But also more generally, trials don't necessarily answer all the questions that we need to answer for an evaluation, whether this is because of the comparators, the patient populations, or the treatment settings involved. And there's at least potential that real-world data can offer value in this context, if not a guarantee. So NICE outlined its ambitions to make greater use of wider sources of data in January last year through a statement of intent. But we identified several barriers to actually realizing this ambition. And I'm going to actually refer to these in terms of the EMA's optimal framework. And key among these are operational barriers, so challenges in actually identifying and accessing relevant data, and also the governance and ownership constraints to this. And I think this is one area where the work of HDR UK with the Innovation Gateway, and also this consortium in terms of looking into the use of TRAs, can provide real value, both to those who are submitting evidence to NICE and also NICE itself. Kathy mentioned at the start that we're thinking more about how we can use data differently to inform our own guidance, or also other areas of NICE like adoption and impact. Then there's other topics around data interoperability and linkage, again, which are partly addressed through this consortia, and then data quality and completeness, which is a persistent concern with this kind of data. And then finally, we have worries about the risk of bias due to confounding selection, poor quality data, and also the worries about the transparency and robustness of these studies, particularly based on retrospective data. So this is really to try and introduce and explain the purpose of the Methods and Standards program. So this is a multi-year program of work which is just getting underway, And the idea is to provide a clear framework for the use of data and analytics in the development of NICE guidance. And it's aimed both at those external organisations submitting evidence to NICE and also NICE staff, our review groups and our committees. And the sort of high level purpose is to ensure that real world evidence is used where it can add value, and that where it is used, it's generated in robust and transparent ways. So I've got here a schematic of the programme structure, and I'm slightly jealous of that wheel that you presented earlier because it looks a lot better than this, but this will be what we work with. So on the left-hand side is what I'm going to talk about, and this is really about producing guidance around the building blocks of what constitutes good quality evidence. So thinking about data quality and relevance, ensuring that we use appropriate methods, and that we characterize fully uncertainty and bias, and that analyses are undertaken, conducted in a transparent and reproducible way. So just thinking about some of the outputs that we want to generate. So one key one is providing a sort of simple data quality assessment framework, which will allow committees to understand the data that's used in evaluations and demonstrate that the data is of good provenance and can be used, or at least potentially can be used, to inform NICE guidance, and then to provide sort of standardized information on data quality and relevance in relation to specific applications. We're also going to be working with the MHRA on data collection through the innovative licensing and access pathway, and then provide guidance on a range of other topics like real world endpoints, selection and validation, similarly with digital endpoints, and then other topics like unstructured clinical data and so on. And these were mentioned but in Jackie's presentation, I think, things that have been worked on within the BHF Data Science Centre. So there's clearly a lot of overlap in interest. And I think also within this consortium, I should say, there's work going on about phenotyping for real world data endpoints, which was discussed at the last month's meeting. Then we go on to methods, and as I say, the idea is to provide guidance, clear guidance on what we expect from submissions using different types of study designs, from external control arms, real world cohort studies, and also the use of real world data in clinical trials, again, which touched upon in the earlier presentation. And I know there's, again, some work within this consortia looking at instrumental variables for, I think, ACE inhibitors and COVID outcomes, using variation in GP prescribing practices to try and draw out causal estimations, which will be very useful and informative, I think, for this work. And then finally, research governance, as I said, just making sure that evidence is generated in a clear and transparent way, from study planning through to the identification and selection of data, the conduct of studies and their reporting. And again, I think based on the work last month, the presentations last month, there's a real emphasis on transparency within the work that will take place within the TRE. So just to finish off, NICE forming a small team to work on this program, but the idea is that we really do try and take a collaborative approach and learn from lots of work going on among the range of stakeholders, including clearly the work of this consortia, both in terms of thinking about how we might be able to make better use of data through TREs and so on, but also in terms of the methodological work that's ongoing. So I'd be very interested to hear people's thoughts about how we can best interact and how we can learn from what you're doing. So that's all I have to present, so I'll stop sharing.
Thanks, Seamus. That's really interesting and great food for thought, and clearly you've highlighted a really fantastic area for potential building of even stronger collaborations between HJUK, BHF Data Science Centre, NICE and the research community. I'm going to